And today we are here with Dr. Visalam Thank you, Dr. Visalam, for joining us for a new episode of Fantastic Hour talking about integrative medicine. Now, as you all know, Dr. Visalam is an MBBS doctor who has finished her MD in physiology and a functional and integrative medicine practitioner. And she's got a lot of other things under her belt, which you will come to know shortly. Now, integrative medicine is something which is catering to a lot of chronic ailments, which goes to the root cause of all problems and then tries to give solutions to the patients. So we are here to ask Dr. Visalam regarding her take on things regarding integrative medicine and the future of integrative medicine.
Thank you so much.
Thank you.
Just to begin with, I tell this to all my patients. When they ask, doctor, what is integrative medicine? The first thing I tell them is, integrative medicine can be explained in two parts. The first one is where we identify the root cause of the disease or the symptom and treat it with lifestyle modifications. Lifestyle modifications being food, movement, sleep, mind, chemical detox, nutritional supplements, and detox therapies. Now, the second part of integrative medicine is why we're calling it integrative, because we are trying to take the good of all the existing medical fraternities and give what the patient requires. In my experience, there are certain diseases which, with the inclusion of Ayurveda, patient gets very, very well. But there are also certain diseases, even with inclusion of Ayurveda, they don't do well. Or only per se Ayurveda, they don't do well as well. So likewise for siddha, TCM, yoga, but now integrative medicine is bring everything together, attack the disease from all fronts with all the different fraternities and heal the patient. That to me is integrative medicine. And what is the future of integrative medicine is a second question, but to me integrative medicine is the future.
Integrative medicine is actually doing very well in the present time as well.
Scenario, yes.
Present scenario, and why do you see that happening often?
Because there's more awareness, number one. And number two is people are not looking for quick fixes anymore. There was a generation where people were looking for quick fixes. But now they all want to go to the root cause, find out and sustain that result. Not quick fixes, not go back to the hospital multiple times, because unfortunately today patients get footballed from one specialty to another specialty. They don't have the time, they don't have the money, they don't have the patience. So nobody's looking for quick fixes anymore. And there are so many diseases today that are not being diagnosed. That is giving this integrative medicine a different light by itself. My disease by itself is not diagnosed. Who am I to get treated with? Where am I to get treated with? What am I getting treated with? That is why integrative.
So patients have a lot of questions as to what is going on with them, and they're actually interested to find out the underlying reason why they're having those problems. Why is that change, or how is that change come about in society compared to maybe 10-20 years ago, when you just used to go to a doctor and just say, you tell all your ailments and then tell that doctor is God, and you just take whatever prescription he comes and take. How has this changed over the last?
Because both the ends has changed, doctor. One is the patient is super educated today. Google Maharaj will answer all your questions. One. The second one is doctor is becoming narrower day by day. Now then there was MBBS. Then now we did specialty, now there's super specialization, and then there's super specialization. The doctors are narrowing their specialty, patients are widening their knowledge. Both ends are becoming, very contradictory. So that's why now patients are looking outside. Now patients don't think doctors are God anymore.
Yeah,
We've come to the conclusion we're all humans, slightly with hardworking humans.
And to err is human. So basically, even anyone can make mistakes. When the knowledge gets more and more specialized, and the focus also gets more and more narrower. So, for example, a patient has chest pain. He goes to a cardiologist, and everything is checked by the doctor, and he says nothing cardiac. You go home. The patient has gone home. He still has got the chest pain. Unfortunately, that is the state of the patient today. If they are left in a lurch. So we hope this integration or integrative medicine helps them going forward, and it is helping them. So how do you approach a patient of chronic ailments, say whatever it is, an autoimmune disease, say for example a rheumatoid or a psoriatic patient, with the integrative approach?
First, for me, like I told you before, integrative approach first identifies the root cause.
Right. how do you
Today,
do it?
today my entire knowledge or my entire experience, as small as it could be, I've brought it down to two things. There are only two things that are causing your diseases, including aging.
Okay.
One is nutritional deficiency, two is toxins. If there are toxins, it does not allow nutritional absorption, and because you have nutritional deficiency, toxins are not getting eliminated. Toxins does not mean these big metals that we're talking about, even if they include, but toxins include, first one is biofilms, that is your past infection and your current infection. Infection could be all your microbes put together, bacteria, parasite, fungi, virus, all put together. Then your second silent toxin is microplastics. Your third toxin is your heavy metals. Your fourth toxin is the auto-intoxicants, the toxins that you produce by yourself by not eliminating completely. These four are, you're surrounded by these four, which are not allowing your nutrition to get absorbed. And if you do not absorb the required nutrition, your liver cannot eliminate these toxins. Liver cannot eliminate, intestines cannot eliminate, skin cannot eliminate, lung cannot eliminate, your kidneys cannot eliminate.
And lymphatics also.
Lymphatics also can.
And when we talk about these are the toxins you mentioned, and what are the most common nutritional deficiencies that we are dealing with?
Vitamin D, vitamin C, your glutathione, zinc.
Okay.
Vitamin B. These are the commonest one. These are the first things that we address in a patient whom we suspect any kind of chronic diseases.
But these are the very common things which are
Available in food.
No, not available. They are the most commonly needed toxins in all the pathways, in curb cycle, in
Needed nutrients in the
in glycogen recycling, everything. All these, what you're talking about is all the common things which should be
there in the patient already.
But it's not sufficient.
It's not sufficient. One is because now you're I think I used to work with a senior doctor, and he said anybody who's born after 1990, they have congenital liver.
All right.
So which means now your liver is quite suppressed. When your liver is quite suppressed, then you're not producing any of it. Your body can produce all the nutrients, but now it's not producing any of it. And the soil has no nutrition, which means your food has no nutrition. Even your food has any much nutrition, you're not digesting it well. And you're not digesting it well, you have absolutely nothing. You're super deficient. So which is why the toxins are getting accumulated. And it's a cycle.
So you're not absorbing it, and you're not
eliminating it.
Yes.
You're not eliminating toxins, you're not absorbing nutrition.
So
You're somewhere in mid-air somewhere.
So it's a double whammy.
Yes.
Both sides you're getting hit.
It is a vicious cycle, yes. And that's why people today get sick much more than people than yesterday. Today sickness is very, very common from children to young adults. Gone are those days where geriatrics are the one who we are talking about. Oh, they might die tomorrow. Today everybody is scared of it.
So when we used to, when we did medicine, and they used to be the first sentence in ischemic cardiac or the coronary cardiac, age above 60 years is what we studied as a risk factor for coronary artery disease or ischemic heart disease. Today, I think we are seeing in as young as their 20s, 30s, and post-COVID in the last few years, that incidence of the coronary artery disease is
rampantly high.
Very, very.
Today, age by itself is a risk factor for everything. Being born by itself is a risk factor for everything. Aging is a disease too.
Yes, aging is a disease, and anti-aging is possible with the right thinking, the right frame of mind, the right advice. It is possible to reverse age. It's possible to reverse disease. Is that what we are able to do? Telling patients with integrative medicine, we can achieve all these things.
We can reverse your biological aging, chronological aging, no. And you can look young, you can be young, you can be energetic. But what I tell my patient on what longevity is, doctor, do you know how long you're going to live?
Absolutely no idea.
I also have no idea how long I'm going to live. So which means if a doctor comes and says, I can give you 2 extra days, that's a big fat lie. Because you don't know how long you're going to live. But to me, longevity is however long you have, you should be able to do whatever you want to do independently. That to me is longevity, which is very much possible today with all the telomeres and supplements and NMN and NAD, all the things that we see today. That today is possible.
So that is actually healthy aging.
It is healthy aging. Yes, it is. Yeah, it is healthy aging.
It's aging healthy and gracefully.
Not aging at all. You still want to look young. You still want to look nice.
Yes, that's true.
You still want to do everything you want to do. I mean, age no bar for anything, right? Today, age no bar, gender no bar, just no bar. Live as long as you want to live.
Absolutely.
In a very happy way.
Yeah, thank you, doctor. Thank you once again for your time. Thank you.